Thank you for joining us, everybody, in this special episode titled now COVID-19 Q&A. So, as usual, it's me, Greg, and we're waiting for Oscar to come in right now. Thank you guys for coming on behalf of myself, Greg, and Oscar. We just want to say thank you to all three of you for joining us, for taking time out of your day. We understand, you all are in the front lines right now, fighting this war. So thank you very much for being here. We can just go around real quick, just introducing yourself. So we can start with Shivan, and then Riddhi, and then Pooja, please.
All right. My name is Shivan Shah. I'm one of the infectious disease physicians that works in Texas. And been working here for about probably 7-8 months now. Moved from Florida. So, yeah.
Okay.
Hi, my name is Riddhi Desai. I'm one of the emergency medicine residents in the Northeast area at an academic center.
Hi guys, my name is Pooja. I'm one of the pediatric hematology oncology fellows and also the Northeast area.
All right, thank you guys very much. So would you all be okay with just sharing a little bit of, how it's going in your respective areas as far as, patient intake, symptoms that you're seeing within the patients, and anything else that you think might be important to mention?
I could start because I think the other two people will have a little more to say because they've probably seen a lot more. So being in Texas, essentially what's going on is we haven't had an influx yet of patients. What we're seeing on East Texas is patients from Louisiana have kind of influxed in from New Orleans. West Texas, it's a little more scarce there because the population density is less, so they're not growing. But Dallas, Houston, San Antonio, Austin are the places that are the hotspots. El Paso itself is starting to become that way. What's caused a lot of problems is the delay in testing that happened, and the delay in stay-at-home orders that we kind of had from CDC, federal government, state government. That let the spread happen a little more than what it should have been. The patients can be asymptomatic and spread. Patients can be symptomatic with a cold and spread. And the incubation time, they just released one study that showed it could be up about 11, median 5 days and up to 11.5 days. And some people can spread even longer than that. Those are the outliers. About 110 patients out of 10,000 can be past 11.5 days. So we're seeing a lot of that now. Again, like I said, we're going to have this influx in about 2 weeks because we've had all these people spreading it around that are not symptomatic. They become symptomatic, and that's when they come to the hospital, and that's when they get tested. When they're not symptomatic, they're just going to stay at home and it's fine. But 2 weeks before, they were hanging out, St. Patrick's Day and things like that. That caused a lot of problems spreading. So for right now, that's what I'm seeing over here, like in Texas area, I'd say.
Okay. Go ahead, Riddhi.
Yeah, based off of that, in the ER, we're mostly seeing a lot of people that are coming in with mild symptoms, like just intermittent fevers, cough, runny nose, kind of like the flu, but a little worse than the flu, I would say, like body aches, muscle aches, things like that. Those people that are like young, that don't have any comorbidities, we're basically sending home and advising them to do supportive therapy, maybe not even get tested, but to self-quarantine for 14 days. And once they don't have fevers for 3 days in a row, then they can go about doing their normal activities, as in like if they have a job and they're not working from home, things like that. Otherwise, we advise them to stay for 14 days at home. And we tell them that if for some reason you start to have shortness of breath, not from like nasal congestion, but to the point where you're like, I feel like I can't breathe, that's when we want you to come into the emergency department, because otherwise, if you don't have COVID, you're probably going to get COVID when you come to the ED, because most of the patients there have it right now. A lot of the hospitals that we are like affiliated with, the ERs are completely full. Most of the patients are COVID positive or suspected. The floors are full, the ICUs are full, so nobody's moving and everybody's breathing the same air, basically infecting each other. So we basically tell people that unless they have difficulty breathing, that they should stay home.
Okay.
That's what
Go ahead, Pooja.
And I can probably speak for the pediatric population. So I see the little kids. My specialty is blood and cancer disorders in kids. And so I deal with a very special population who are very high risk for infections. Thankfully, COVID for kids has not been very intense. The kids have usually had milder symptoms with just like a cough, a runny nose, fevers. And then in my population of kids on chemotherapy or on immunosuppressive medications, they show up with random stuff. Like we've had one kid with only diarrhea. We've had one kid with abdominal pain. We've had fevers. We've had cough. We've had runny nose. We've had full body aches. So they've just been very non-specific symptoms that ended up being positive for COVID. And so for kids, I think overall in general, they've just been getting a much milder disease. However, they can shed it onto parents and adults, and especially it's important to keep kids away from their grandparents because the elder population has had a much more severe disease compared to the younger population.
Right. Okay. I think one of the main topics that I wanted to speak of is the transmission, because I feel like the transmission of this virus is something that's still, there's so much information out there, and some people, like the CDC, for example, I believe was saying that it's droplet. And then there is a doctor who was known for being on the Joe Rogan Experience, Michael Osterholm. He is saying that it is airborne. And in his opinion, even the use of masks might not be very beneficial as far as surgical masks. He even went as far as saying that they're doing studies in his lab that have identified that there's receptors in your eye that aren't really picking it up. It's mostly in your nose and in your mouth. So is there something that you all can speak of here as far as transmission?
Yes, so I can answer a few questions to that. So transmission basically for this, it was a growing area that of basically just interest that we've been seeing, because we don't know exactly how this is transmitted to the degree that we knew some other viruses. The most common, influenza, I'd say. Influenza is not airborne, it's a droplet. And droplet meaning, forms in the water particulates. So, or when you cough, you get water particulates or sputum particulates, and it can live in those, and that's how people get it. So you can't just cough without, if it's a dry cough, you won't be spreading it. Now, with COVID, what we're seeing is people are spreading it kind of a little more faster, and the transmission rate's a little faster. Certain studies show within 2 minutes of exposure to a person with COVID and close by, you can actually transmit.
Right.
So that's much lower than other viruses and other pathogens. What the concern is, and that's where is that maybe we got transmission wrong. We're not 100% sure. No one is certain yet. And they're doing studies, as we discussed. This could be airborne. That is 100% true. We need more studies with that. And that's what I think they're working on. Now, concerning that, the mask question that you were saying with the surgical mask may not be enough. And that's what we're having lack of right now that's what we only have essentially, and we have lack of N95 masks, which help protect us from airborne pathogens as healthcare workers. So that's one of the biggest problems that we're seeing. And airborne also does mean that in close quarters airborne. It doesn't mean outside in a park and you have like two other people that are like 10 feet away. They can't cough and it's gonna fly into your mouth. No, it doesn't work like that. But if you're in a close quarters, and that's what we saw kind of in New York and big city metropolitan areas, people are crowded, they're cramped up. That's how they get spread. So we're gonna get more details on this in the future, and it'll probably be within the next 1-2 months that we find out more about it. Different entities have released different information. You're correct. CDC, the WHO, they're saying just droplet. At this time, that's the most information we have, and we're going to learn more. This may change. No matter what people say, in a week from now, things are going to change. Even what I'm saying now can change. So it's an evolving field, an evolving disease that we're learning more and more about. And one other aspect that I think people have been worried about is surfaces. Where can it transmit on different surfaces? There are some preliminary studies that showed plastic surfaces and some metal surfaces potentially have a longer time to stay. The coronavirus could stay on it. Again, these are based off of 1 or 2 studies that, could be wrong. We need more studies. We need to review a lot more. And I think that's what we're lacking right now, essentially.
Right. And then you had also mentioned that this virus is still evolving, right? So I just did a little bit of research and found out that this is a single-stranded RNA genome, which makes it more susceptible to mutation, right? So is that because I don't really hear people talking about that, about the mutation of this.
So this is the thing about corona. So coronavirus, just a little back history. Coronavirus itself is a old virus that we've known about for years and years and years. And some would say it causes a common cold, actually. There's different types of coronaviruses. SARS, if you remember SARS from way back, SARS is a coronavirus. There's another virus called MERS, which is also a coronavirus. What happened is a particular coronavirus decided to somehow mutate itself within an animal. Typically, we've seen it a lot of times in bats. We're not 100% sure which this one mutated in, but it did mutate in something, usually a small mammal, and then it's able to transmit itself from that small mammal to humans. So that's where those mutations come into play. Again, there's a lot more even studies with that, but there's so many coronaviruses out there. But what we're worried about is this one is become kind of a balance of keeping enough people alive to transmit easily, killing off enough people to make it worrisome.
Okay. I think the question
Oh, sorry, what?
Oscar just came into the room. Hello, Oscar.
That's
crazy. So this thing is has a mind of its own. Like he's saying, keeping enough people alive to transmit it and killing enough people to make people scared. Like, that's freaking crazy.
I just like that he mentioned the fact that it's been around forever to dispel any of those Lysol conspiracy theories, how Lysol had Corona on it already. And people are like, what?
Well, the coronavirus has been here. If you look up SARS, MERS, all these, it's been there before. You can look up many coronaviruses. It's old.
Yeah.
It wasn't named after the beer, so it's.
It was just also another thing I wanted to talk about is people who are most vulnerable, right? So here in El Paso, this video is mostly made for people in El Paso so that they can be aware, because here we have a few restrictions, don't go out, but everybody's still going out. Nobody's really listening to the rules. And in here we have about a 15% rate of diabetes. Many people are smokers. Young people have they're vaping. So are all these people at a higher risk of having bad effects with this?
Oh, absolutely. All of those people, everyone that you just mentioned, is basically has like a decreased immune function and are more hypercoagulable. They're more prone to getting infections and having worse outcomes because their body is just not able to cope appropriately, as opposed to someone who doesn't have those comorbidities or someone who doesn't smoke. So they should be the most careful and try to stay as healthy as possible, whether it's changing their diets or whether it's changing their diets and remaining quarantined, because if they get sick, like those are the ones that are staying in the hospital, that are being admitted to the ICU, that are being intubated and not having the best outcome. So
right. I feel like the people here in El Paso, I feel like they need to be for lack of a better word, scared. They need to be scared into listening to the directives because
like, you don't believe it till you see it,
Right.
Most of the country doesn't believe it right now. It's just
right.
parts that are being hit hard that actually understand what's happening.
So then, you being in the emergency room and seeing the ugly side of this, can you maybe give us a few examples of what you're seeing with people with diabetes, people with smokers? How is this virus manifesting itself in ways that, you know, you can maybe paint a picture?
I mean, mostly first, like in the beginning, like I described, it kind of starts off with like the vague symptoms. Like you feel like you have the flu, but it feels a little worse than when you've had the flu before. And then patients just start to become progressively short of breath, where when you can normally walk around in your apartment and you don't feel short of breath and you're in your 30s, now you're like walking from your kitchen to your bathroom and you're literally like, you're like panting. And that's how they come in. And then we check their oxygen levels. Their pulse ox is like 30% on room air. We get a chest x-ray. Their x-ray just shows basically something we called ARDS, like acute respiratory distress syndrome. We're not sure if that's exactly what it is, but there's infiltrates all throughout their lungs. You're not able to even see like their heart borders because it's just full of like debris or infiltrates. So they're obviously not able to oxygenate well. And then it's hard for us to work with that because it's already too late. So a lot of times these patients that are really young are getting intubated. People that are like, most of the people are either like morbidly obese or they're like young people who are smoking or they're very old. So it's kind of like all over the place, but there are a lot of young people that are getting sick.
Young people. Okay.
Yeah.
Yeah, but it doesn't matter if they're obese or not. I mean, that's from. I mean, how vague is the media that some of them say like, oh, there was athletic doctor got it, and then you know you hear like, oh, the sick people get it.
The
So
ones
it's pretty
that
much
are the ones that of like all of the people that I have seen or that I have intubated myself have been morbidly obese just because of the mechanics of breathing are very different. So that's something that I've noted that a lot of us ER docs have noted as well. And it's harder to also get them off of the ventilator afterwards. So it's kind of tough when you're like a 35-year-old that's going to be stuck on a vent for a while and we're not really sure how the disease is going to progress. Like right now, it seems like it's bimodal, but some people are having trimodal reactions too, where they're getting better, they get extubated, and then they get worse again, and then they have to be re-intubated. So,
okay. As far as diabetes, from my understanding, the reason they're affected is because with high glucose, your immunity drops a little bit. Can you explain that a little bit, someone?
So essentially, there's multiple things with diabetes. Diabetes affects your white blood cells to actually get rid of certain infections. It also causes microvascular damage. So you end up, your vessels aren't working correctly and you can't get to certain areas. So you see a lot of people with ulcers on the feet because of that. Diabetes, when you get a hyperglucose, it affects all your electrolytes and everything like that. Your kidneys are damaged.
it affects every single system of your body, essentially.
Yeah. Your heart. So what ends up happening is people get infections and they get worse outcomes because their body can't like compensate for it. So you see patients, there's a study with influenza and heart attacks. After getting influenza, patients were getting more heart attacks, and especially patients that had diabetes. So it was interesting. Influenza is a pro-inflammatory virus, and the concern with COVID is this could do the same thing.
Mm-hmm. And as far as smokers and people who vape, how are their lungs compared to others?
No.
So I think Riddhi can answer a little more because she's probably seen in the ER a bit.
Yeah, I mean, nothing. I mean, I can't really like make a distinct comparison, but like oh, like you're a smoker versus you're not. But the way that they're healing, it's kind of like the same way as having diabetes. It affects every single system of your body at the end of the day, and you're just not able to heal as well. So you may be stuck on a vent more likely than you will be on other things. And the reason why we have been intubating more than doing other things, like using like negative pressure ventilation like CPAP or BiPAP, because that causes respiratory droplets to be transmitted. So unless a patient is not in a negative pressure room, which there's not that many in every single hospital, you have respiratory droplets being spread everywhere.
Right.
Now we're trying to do that with putting like viral filters in between to try to decrease that transmission, but it's still not ideal. So a lot of these patients are not even given that chance of trying to use those modalities to breathe better and are just being intubated. So now we're trying to come up with other ways to prevent that because we see that they're not coming off of vents. So it's not good once you move in that direction.
Right. And you mentioned intubation and ventilators. I understand that's a huge concern right now.
Yeah.
How are you all dealing with these types of shortages, or preparing, in your case, Shivan, for this wave that's coming?
So Texas itself right now, FEMA just sent a bunch of ventilators to Dallas. They sent a lot of other supplies to prepare essentially for the oncoming wave of COVID. But the lack of PPE, so protective equipment for healthcare workers, is we don't have it. I'll be honest with you, and it's we're not prepared anywhere in the country. This is for anywhere in the country, I'd say.
Wow.
What ends up happening, you're supposed to, when you go into a room that somebody has an infection, you're supposed to use one gown, one mask, and you're supposed to throw it away afterwards because that could have infections on it, and then you could spread it to the next patient. What's happening now across the country is we have to reuse it or wear it in the next room or something like that, which is terrifying indeed. So that's a big problem. But right now for ventilators, we're Texas, from where I'm seeing, is a lot better of a condition than the Northeast.
Okay.
So,
in the Northeast, what's the situation?
I mean, at my hospital, we are connected to the adult hospital, who has basically taken over multiple floors in my hospital. They've taken over the ORs and they're using them as ICU beds. They've taken over the PACU, which is where you go before and after surgery, using them as ICU beds. The Central Park is starting to set up an area where they can start treating patients. We have a huge Navy hospital ship that came in that can basically take up to 1,000 ICU beds that are not COVID, that will basically take pressure off of New York and open up other ICU beds that were used as non-COVID beds for these COVID patients now. But they're honestly running out of ventilators, and you have to make a decision as to who lives and who doesn't, unfortunately.
Right. I mean, that's the fear, right? That
and Riddhi can definitely speak for that more than I can.
Yeah, that is basically the same. They're starting to have to risk stratify and think about things like age, what your prognostic factors are. If you're already intubated, then kind of have to make decisions with families and decide whether the patient needs to be terminally extubated so that now they have a vent that they can use for another patient that might survive this. So it's kind of tough. Our rules and our protocols are changing every day about it but we basically get a list every morning that tells us how many vents are available. And then we try to go from there, and we try to prolong it as much as possible and try not to intubate people unless we really need to.
Wow. Are you all using, because I understand there's some hospitals who are trying to use one ventilator for several people, maybe hook it up to 4 people at the same time.
It's a lot of people are trying to, or have been, or I don't know a lot, but I know of some that are trying to do that. They're 3D printing filters to put in it so that you can have 2 or 3 people on the vent at the same time. But it's also kind of risky because everybody has different breathing mechanics. So they all need to kind of be at the same exact pressure, need to be breathing at the same exact rate. And one person can't stimulate the other person
more.
to breathe and things like that. So it's very tricky, and it's very hard to manage, but some places are doing that.
Shit.
Wow.
Yeah.
It's like a 3-legged race, but worse.
Yeah, literally.
Damn, that's crazy.
Yeah.
So I mean, I know right now we're focused on getting rid of it. We're not getting rid of it, but mitigate everything. How do you think we can prepare in the future for something like this?
Make it out of this first.
Yeah, that's what I'm saying. Right now we're kind of focused on getting out of this first, right?
So
yeah, I guess what he's trying to say is what are some mistakes that are clearly being made that you're
right. I just
No,
I can't even think about the next pandemic. I don't know.
so this isn't the
had so much time and heads up and warnings from China and Italy, and all of us just sat here being like, oh, this will never happen to us. we were given so many warnings. Time. In fact, New York is one of the first areas to shut down in America to fully, with like New York, Seattle, California. But even then, we were too late to shut down because, as Shivan was saying, it sometimes can manifest 2 weeks later. And so we had so much time and so early warnings to like halt, and we didn't. We didn't until it was way too late, and too many people have been affected.
You think it would have spread regardless, though? Like, even if
no. Right now, with all of the isolation orders around the country, there's actually new data coming in saying that it is helping to flatten the curve. So it absolutely would have helped had we shut down the country a lot earlier.
Okay.
I mean, not to get political, but it's hard to avoid the political part of this. What effect did our leaders have, or what missteps did they make that could have helped avoid this?
I think there's so many things, but like funding is huge, because it's like a lot of times when patients have asked me, like, why won't you test me for corona if you think that I have it? And I'm like, I have to explain to them in English to patients that only speak Spanish that, like, unfortunately the government did not fund us for this, and we literally don't have tests. So if you get worse, I want you to come back, but if you don't, then I need you to stay in your house. But like that's like money's been a huge thing. Like,
yeah. So I'll show a little. I'll discuss exactly kind of what happened too with these testing kits. There's actually a great podcast by a German doctor. I'm blanking on his name. He during the SARS epidemic was the one that kind of helped first identify SARS that was coming out of China. He was noticing this, and when this new pneumonia was coming out, COVID was coming out, he wanted to get a sample from China. China was kind of keeping it on the hush at this point, and they didn't want to get a sample out. He's been making these testing kits with the WHO pretty early from Germany. There's a great podcast. Unfortunately, it's in German, so we're waiting for a translation of that. But our country rejected those testing kits early on. Could be multiple reasons. We don't know the real reason why. And now we're trying, we're kind of delayed in getting the testing kits. And the unfortunate thing about testing kits are we have to validate them appropriately before they can be used. The current testing we have multiple of them now. Some testing takes 7 to 8 days in more rural regions. In more emergent regions, it'd be 24 hours. And now they have this 15-minute one that's still not appropriately clinically validated yet. It's validated in a lab. FDA approved it because they have to. We need something more, better. But we may get false negatives with that. There might be, we miss 30% of the patients we test with, and they still will spread things. So testing's been extremely hard, and in a country of our size, it's much harder than some of the smaller countries that people are talking left and right about. That I've heard people comment like, oh, Iceland is testing everybody, but Iceland's population density is not the same as the US. So you can't compare those two. But then you have other countries, you have like South Korea and Italy, who had the same time of the outbreak. South Korea has way less mortality, and that's because they started early testing of everyone. And Italy was delayed, and they have a lot more mortality. So it's very hard to say, why the testing wasn't there. And you're right, it could be the political nature, but also it's very hard to validate these tests appropriately.
And I also just want to add to that, not only just validating, I don't know, Shivan, about where you guys are doing, but for us, I feel like our test sensitivity is only like 65 to 70%.
It's about 70%.
But
it's probably the same
also
one.
A lot of it is user error. You really have to stick that thing all the way back into your nose to collect a good sample. And if you don't, then you get a lot of negatives, and we end up sending these people home being like, oh, you're negative. But God only knows like what we've released back into the community, because we haven't like stuck it all the way into their brain.
Oh God.
It's not really in their brain, but it feels like it's going in their brain. Just
Well,
letting you guys
yeah.
know.
Like really in the back of your nose.
It's through your nose all the way back till it makes you cry. Essentially, that's
Oh
what.
man.
Yeah.
Because that's
I
where it
wonder
lives.
if I could.
That's where your virus lives. It lives in your
Oh,
oropharynx,
shit.
which is like your nose and your mouth and your respiratory area.
So like with
I
the
was-
allergies going on right now, like I know there's a lot of cedar in Austin, and right here in El Paso, there's a lot of winds going on, and allergies for me is terrible. So I mean, is there a lot of patients going in for allergies and being like, oh, I think I got the corona?
In Texas, I could say that. So in Texas, yeah, cedar season. Essentially, what's going on is what we see is patients could have varying symptoms. So some people can have less, even if they have a cough and even a low-grade fever. Certain centers in Texas are testing for it. Now, those are not all the centers. So I'm going to be honest. You cannot just go out and get a test.
Yeah.
Realistically, there's only certain places in Texas.
The test, honestly.
And then, yeah, going back on that, I as an infectious disease doctor, if I had an ideal world, I would love everyone to get a test. Because then there'd be an easier way of controlling this.
Yeah.
So it'd be great, but you cannot get a test everywhere because just lack of testing, not enough manpower to perform all these tests. So it's hard to say that. So I would love everyone to get a test, but it's hard to.
They need to come up with a better way to test people, like a self-breast exam kind of thing.
Well, so that's what they're trying to do an at-home. They tried developing an at-home one. They're trying to develop this 15-minute one. But again, it takes time. This next 2 weeks, as I don't know if anyone saw Trump's speech, these next 2 weeks are going to be terrible. He's not wrong. He just was delayed in saying it. That's all.
I was hoping that I could show my ignorance here for a second, because I had more. It's not really a question, but it's more of like an idea that I've been thinking, and maybe you guys can shed some light on it. So, what exactly is it that we're waiting for? Like, what is the plan here? Because what I'm thinking is we're not going to be able to eradicate this thing until we finally find like a vaccine. And I know there's different strains to it and everything, so it's complicated just to say we're going to find a cure. So what exactly is it that we're trying to do? Are we trying to delay the spread so we're just more prepared to deal with the sick?
We're trying to prevent this from becoming a seasonal thing, like influenza.
Shit. Yeah.
That's number one. We're trying to, again, reduce the amount of mortality in the country right now. There's always, unfortunately, an acceptable mortality to these infections, right?
Right.
You hear that's what the flu essentially. People don't
Definitely
like,
flu.
it's a flu,
Yes.
But realistically, 50,000 people die of the flu a year in the U.S.
True.
Yeah.
But also, just the whole concept of flatten the curve. It's not that we're preventing everyone from getting sick. We don't want everyone to get sick at the same time, because we already know we don't have enough materials or the space or the manpower even to treat everyone together. So everyone may or may not get sick eventually, every one of us, but we just don't want everyone to do it at the same time. So that's a point of staying home, so that we sort of get everyone sick in waves rather than all at one go.
Okay. Yeah, because that was one concern that I had, because I know when I was reading the first initial CDC briefings, a lot of it was basically the same thing. Like, everybody's going to get exposed eventually, kind of seemed like it. And then, of course, it's just a matter of who's going to show symptoms and who's not.
Yeah, also back to your question about allergies, because I think that you said you're recording this and we'll be sharing it with the community. Allergy season is like kicking in now. And one, it could be coronavirus and your allergies at the same time. And two, it could be allergies. Most people that I know, I know a lot of residents were quarantined that were positive for coronavirus that basically just had mild nasal congestion the whole time. So that is possible. Oh, wow. But usually you will also have like intermittent fevers. Sometimes they're low-grade fevers. And if you have fevers with the runny nose, then it most likely is a little more than allergies. So at that point, if I had fevers and a runny nose, like I would quarantine for 14 days and not go to work and things like that.
Yeah, because I did go to like an urgent care, and they told me, I was like, yeah, just stay at home and be there for 14 days. They didn't tell me what it was, if it was allergies, if it wasn't. They're just
Yeah.
like, you know what?
They-
Stay home for 14 days.
They're
They
saying
can't tell. Yeah.
like because it's like more like better safe than sorry, and the more people
Yeah.
tell to stay home for 14 days, the less people will hopefully be out and about and spreading it or getting it from other people. So
Yeah. But it was funny though, because the nurse, like, he kind of gave me his face like, oh, I'm so sorry, man. Like he broke the news that I got like some terminal disease. Like, dude, like, I'll be fine, dog. I'll be fine. Yeah, he's all hugging me and all this. I'm like, dude, like, what are you doing?
And you're like 6 feet apart.
6 feet
You're like
apart.
6 feet.
Yeah.
As far as you all being on the front lines and being right there, in contact with this virus, what are you all doing to protect yourself? Because I mean, it must be scary waking up every day knowing that you have to go to work, having to hang out with your family after, if you even can. Maybe you have kids, you have a husband. What are you all? What's going through your mind?
It sucks, honestly. Like at work, I kind of like put on my front and I'm like, I've wanted to do this my whole life. Like this is an honor and I'm going to wear PPE and protect myself in any way that I can. But when I come home, I shower immediately. I don't touch anything in my place. I like throw my clothes into my laundry machine immediately. And
Do you say Kobe after you throw it?
I do say, I usually miss those. So it's like kind of, yeah, I don't know. It's an angle.
Shaq?
It's the angle. But I also like feel kind of isolated because I don't want to go home and see my parents because my parents are getting old. My grandfather lives with them and like I've been exposed so many times, like constantly in the ER that I know that I could be a carrier and be asymptomatic and I don't want to be, I just don't want to get anyone else sick, especially like my family. Like I would feel awful. So, and I also like don't know how long this is going to last for. Like I think I'm going to be seeing these patients for months and months. It's not going to be this crazy, but like I don't see myself seeing my family for the next 3 months at least.
So it's going to be delayed. It's going to be different across the country about timeframes of when people can actually get out of quarantine or lockdowns or stay-at-home orders. What I'll say as of right now in the country going on, New York may last a little bit longer. New York, Jersey area may last just because of the amount of patients they have with COVID.
Yeah.
Florida's going to be the next epicenter because such a delay of stay-at-home orders. People were still frolicking on the beach. They were still, traveling there and all this stuff. So
break in Cabo and then came back to Florida.
Yes, and they were all positive.
There was that's Texas. That was
Florida
Texas.
didn't get the stay-at-home order until tonight at midnight.
There was a group of Texans that came to Austin. Actually, they chartered a flight to Cabo. 28 of them went. 28 of them were positive for COVID. This is what's happening.
Definitely sucks. Like I am with Riddhi in the same situation. Like you do the best you can to protect yourself in the hospital. Yeah. You don't have adequate gear. The gowns that my hospital has are like will not protect me. They're entirely very thin, so see-through. The caps is nothing. Nothing's protecting my neck area. Totally exposed to anything. We just got goggles maybe like a day or two ago. I had family mail me N95s because we have one to use for this whole time.
Oh my God, one mask?
Yeah, one mask.
That's what's going on right now.
Yeah, so some hospitals, honestly, like my friend is in DC and he's a pediatric pulmonology fellow and he doesn't even get an N95 for someone who deals with respiratory issues. Yeah. They give him one surgical mask a day and those things are very flimsy and do not last all day. I actually feel blessed that I could even get one N95 out of my hospital. Mm-hmm. But honestly, it's not enough. And I see all these people on Instagram and like social media who are using up these masks and gloves and whatever else. And I just want to be like, donate it all to the hospitals. And, like it's nice to have it at home, but if you're going to stay at home, like you don't need it. And like, we really do need it out here. And so you do the best you can. You strip out your door, you run into your shower the second you get home, you wipe down your keys and your credit cards and everything. And you become a neurotic person just so you can keep it from spreading. Like I live in an apartment building and I have elderly neighbors. Like I would hate for for me to infect the doorknob to the building and then everyone gets it. So you just reach this level of, I don't know, crazy just to protect your community. And I feel like everyone should be doing this, but they're not. And then it gets very irritating.
Right. I understand that several hospitals are also reusing their masks by maybe disinfecting them or using UV light.
Absolutely. There's multiple ways to disinfect your mask. Not really sure what it's entirely working for everyone. Some people say use Lysol. Some people say keep it in the oven, let it bake on a really low temperature for 30 minutes.
Oh my God.
So there's lots of different things. And then the worst part about all of this is that now hospitals have to limit visitors that can come in. So some people unfortunately are dying alone, or some people are going through this alone, and some
people
women
can't see their firstborn child.
Exactly. Women are giving birth without anyone else. Luckily, New York just lifted that. They're allowing one healthy person to come into the room, but like for a period of time, women were giving birth alone. So this whole thing just has such a big impact on community and well-being and just togetherness. There's big like things coming up for the Jewish population and the Muslim population with Ramadan, and they won't be able to celebrate or be with their people. Everyone's going to be alone. So it like in the long run is just sucks. And sometimes you come home from these really long days and you just want to hug and you like can't hug anyone. I haven't hugged anyone in a really long time.
I'm also a hugger. It's been really hard for me.
It's such a word
with disgust, and you're like, all right.
No.
Listen, at least now we know that dogs can't get it, so just hug a little dog.
I know. I definitely wish I had the ability to self-quarantine for 14 days and get myself a dog, but unfortunately I would kill that dog because I can't even keep my cactus alive.
Oh no!
So all this talk about like having everything open by Easter is like just unreasonable then, right? It's just insane.
Oh no, you shouldn't. And if things were open on Easter, if people tell you to go to a church for Easter, just don't. Celebrate at home. Celebrate, small family, with your family if you haven't gone out anywhere. But don't do large gatherings. Don't 100% do not go to the church, because you will get it there likely.
Yeah. Christ might have risen from the dead, but you won't. So don't go to the gatherings.
John Oliver,
100%.
John Oliver had a hilarious thing about that. He was saying that John wants to celebrate Easter, and it's funny that it's a celebration of when God was supposed to stay inside but didn't.
Yeah.
Oh, dang.
I mean, yes, things are very boring right now, but please, everyone needs to stay inside. I get it. Try to get through Tiger King. Try to watch whatever you can. But it is
Netflix.
Get Netflix. Get Disney Plus. Do whatever you can do to just get through this. Once all this is over, go travel after that. That's fine.
Yeah.
Also, really awesome that you guys are doing this for your community, and I don't know, I just hope you guys share this, and if you guys ever have questions, feel free to ask us about anything, any specifics. It's really awesome that you guys are trying to keep your community safe and well educated on what's going on.
Yeah.
Yes. Thank you all for being part of this.
Yeah, thank you guys. Appreciate it.
It's
actually
what's going on.
Yeah, well, because here, I mean, it's a majority Hispanic population, and many of our parents only speak Spanish.
Yeah.
So we're hoping to translate this, put some subtitles on the bottom in Spanish so people can be aware. And that was another topic I wanted to touch on. I was speaking with Sunny earlier about, minority populations, how for some reason, a lot of myths go around. Like he was saying that in the Indian population, people were saying oh, well, no, we're naturally immune to this virus. Also in the Mexican population, people are saying, oh, well, Mexicans, we grew up in the dirt. We're good. We're not going to get this virus. We have natural immunity. And it's there's also a lot of things going around oh, well, the heat's going to get rid of this virus. The sun will come out and kill it.
So what's interesting, so there's I'll start with the heat thing. So the heat thing comes based off of, it's not heat, the climate change. What happened is they go based off of SARS, which again is a coronavirus that happened a little back, I think 2003 time. SARS essentially got reduced in the world based off of a few things. Is people were washing their hands more, isolating more, and this was in China and Asia. That's why we didn't see too much of an effect in the U.S. during that time. Animal husbandry practices changed, so people weren't the way they were handling animals and things changed over there, and the weather got better. They don't know if the weather helped. It could be a confounding thing, but they think because the weather got better, it got hotter. These viruses, that's why in flu season, the reason why there's a flu season is because during the summer months, you don't see flu because flu doesn't like summer months. Flu likes cold, dry, wet environments, essentially. It doesn't like the warm, humid stuff. So that's where they were basing off of. So there's a little bit of truth to that. We don't know. Now, again, with these myths that we were saying, we've gotten messages from all our parents, I'm sure, being Indian, about using steam to like get rid of it. If you put oil in your nostrils, it may help out with it. All these things really don't work. It's not really it's myth at that point. But the main things, and again, even the medications we have right now, the treatments we have right now, we don't know if they're actually working. We're trying to study that right now. They're trying to use controlled studies to figure out if they work. So this is an ever-evolving field still, and we're trying our best, but we need more time, unfortunately.
Can you shed a little bit of light on the treatments?
Yeah. So the treatments that are out, the famous ones that President Trump tweeted, the hydroxychloroquine and azithromycin. Right now, so it's based off of a study that was kind of flawed out of France. There's a lot of bias to the study, and it was a small group of people. We're not 100% sure it works. I'm not saying that we shouldn't give it. If the patient's sick, we should give it. But we're doing more studies regarding it. What we're seeing, unfortunately, though, is people trying to hoard it and they overdose on it. It is the combination of those two medications is extremely detrimental to the heart. Potentially can cause sudden cardiac death.
Wow. Oh, wow.
So you need to make sure it's in a controlled environment. So when you get it, you need to make sure you have an EKG. You need to repeat the EKG. We got to make sure your heart is okay. If you have arrhythmias from before or you're on other heart medications, it could be pretty detrimental. It has a lot of drug interactions too. So, you'll see people trying to hoard it or take it preemptively. No studies have shown that preemptive taking helps. No studies really have shown yet that even after you've been exposed, you could take it and it works. They're doing studies about this, but we don't know yet. But those two medications together and I will see it. People will die of heart arrhythmias, and it'll be sudden. They'll die right away.
Oh my God.
What kind of medicines are these antivirals that you're talking about?
So one is an antibiotic. It's a Z-Pak, azithromycin. It's a common one that people use all the time.
Okay.
The other one is Paquinil or hydroxychloroquine, which is actually used in rheumatoid arthritis and lupus. And also it's sometimes was used like a anti-malarial medication.
So are people with lupus more do they have, like, they say that they do get COVID, is it harder for them?
They're studying that right now if they're on the medication. So they actually are studying that. They're trying to see a subset of patients that, hey, does being on Paquinil or the hydroxychloroquine already make a difference? So they're looking at it. It's still going to, probably in the next month or two, we'll find out maybe a little more to that answer.
Yeah. Beautiful. And then for Pooja, since you are working with cancer patients, what's going on there? I mean, these people are, severely immunodeficient.
Thankfully, it hasn't been shown to be any worse in immunosuppressed children that we've seen. Out of I think I have 10 to 15 positive kids on our department. Of that, 2 of them are in the ICU right now, and only because they were severely immunosuppressed. But the rest of them, as Shivan was saying, the 2 medications together can cause issues with your heart. So what we've been doing, we've been giving azithromycin and Plaquenil, but they've all been admitted for the full 5 days of the treatment, and they've all been on heart monitors just to make sure that they're okay, and also to make sure that there's no worsening of symptoms, because my kids can go down south fast. Luckily, with this compared to the flu, when you have the flu, you can get a bacterial infection on top of the flu much easier. With COVID, they've seen that there's not a lot of superimposed bacterial infections, and so that, I think, is protecting my kids a little bit. So we are using the same treatments. For the kids in the ICU, we did get the compassionate care medications that are the antiviral ones that are harder to obtain, that are really only being used for people who are in much severe illness. So basically same thing. There really is no data that's great out there in terms of treatments. It seems like every day my infectious disease team has like a new set of roadmaps to follow for what treatments use on kids. And so we just really have to hope for the best and try and keep everyone safe and not out in the world right now.
As far as, okay, so now you mentioned earlier, okay, so hospitals are being overwhelmed. You all are suggesting, people stay at home maybe, especially if they have mild symptoms, correct?
Yes.
So the thing here is, I've also been hearing that, non-steroidal anti-inflammatory drugs like ibuprofen or aspirin, these have a negative effect on your immunity. Is that correct?
So they've been shown, like data has shown, and it's all anecdotal, that because people had been taking these medications, they put them like straight into kidney failure, and so that's why people are really scared to use them. They're really scared to use steroids as well.
Yeah, this is the thing about this data, like she said, it's anecdotal, so it's based off of experience. It's not based off an actual study. I do think just at this time, and I think this is the consensus, is just avoid them if possible. Now, there are certain people taking aspirin for certain reasons. There are certain people taking the NSAIDs for other reasons. But it's best to consult your local physician regarding it. And it's anecdotal, meaning it's based off of experience, but not a lot of experience still. Right. So we're still learning more about it.
So what if, because one of the effects of this is a fever. So in order to reduce your fever, would you recommend maybe acetaminophen more?
Yeah, Tylenol, yeah.
Tylenol. Why did you just say Tylenol?
Because I'm trying to sound super smart for your stuff.
Active ingredient.
Jesus Christ.
I love it.
I have just a question. So is there a certain diet that we can follow to help combat it or to prevent it? And working out, does it help to prevent it, or does it help when you actually have it, or does it actually affect you? Like, you shouldn't be working out.
So what I'll go with is, well, let's start the diet. Unsure, realistically, and nobody can answer this right now. Yeah. If they try to answer it, they're probably wrong because
bullshitting you.
Yeah, exactly. So I'll be. Then no one knows. We don't know yet. Whatever. I will say, still maintain whatever diet you're used to. Again, keep a healthy diet. Try not to go crazy. Sugars and be healthy. In general, just do what you would have done to try to be healthy. Don't eat a lot of fried food, fast food, whatever. Try to cook at home a little more if you can right now. I'd say that's probably the best thing, right? Now, going to, like, gym-wise, work out. But the issue, I'll say, is do not go to the gym and work out. You'll be exposed. I'm sure a lot of places have closed or been down. Work out at home. Do what you need to do. If that means going for a walk outside, that's fine at this point, I'd say, especially in El Paso. But, like, avoid people. Don't go on a walk and go walk to, like, a group of, like, 10 of you guys and stuff like that. Then it's, you're going to get exposed, So it's about going for a walk or trying to go for a run by yourself. That's fine. Like I said,
but also just to add on to exercise, when you sit at home, like if people are self-quarantining, they're just sitting at home, you don't use your entire lung capacity when you're breathing. You only use a very small amount of it. And that can lead to earlier collapse or atelectasis, they call it. You're just kind of sitting there, you're not using it. The alveoli, the little air pouches in your lungs, all of them don't inflate. But when you're exercising, you're inflating all of them. And so it's keeping all of that well aerated, it's keeping it healthier. You're using all your lung capacity. And so, I mean, again, anecdotal, but it would just help to keep your lungs healthier by using them and at least inflating them and taking deep breaths and just inflating as much as you can of your lung to get. In general,
you should work out or do some sort of movement. Don't sit at home on the couch at all like that. Yeah, sit at home on the couch, you know, whenever you want to a little bit watch TV. But after that, you should do something a little active.
Do something.
Yeah. Everyone, even the older people, should do something active, I'd say. Not just sit around and everything.
Just for, you know, people and the older age, what do you guys recommend they do, you know, for their everyday life? Like if they're just going out to the store, just coming back home. Do you recommend wearing gloves or carrying around sanitizer?
I don't know what the situation in El Paso is, but here in the tri-state area, a lot of the grocery stores are opening earlier just for senior citizens and for those who are immunosuppressed. I think you should really take advantage of that. There's less people there. Everyone's a lot more careful. They're more about following the rules. Stay 6 feet apart. It is a good idea to use gloves and masks if you're in public. You don't know who's around coughing. You don't know where the droplets are coming from. Again, you're touching carts that other people have touched. You don't know how clean they are. So it is a great idea. You should also just like wipe down your groceries when you get them, when you come
when you
home.
get home.
And the groceries.
Wipe down the grocery. That's what I was gonna say. Try to. The other thing is when she's putting on and off the mask, she make sure she doesn't touch her face or she doesn't remove the mask 10 times because you don't wash your face as many times a day. You wash your hands the most, and you don't so you'll touch your face, right?
Okay.
And that was the biggest issue with people using masks is they weren't using them correctly. When you use a mask, you put it on, you leave it on, and then you take it off when you're ready to take it off. Try not to make sure it gets soiled. And you take it off from one hand only. Try not to do both hands. One hand only, take it off, and then either you throw it away, but if you can't throw it away, keep it in like a one bag, a Ziploc bag or something if you need to. But
I would air it out. Just air it out so it's not wet.
Exactly. And you don't want it wet. If it's
so
wet,
don't do a plastic bag. Do like a brown paper bag.
Yeah, that's fine.
That's good. Yeah. Okay. I didn't know that.
I think this last topic for the end because it's a topic of, I know it's going to spark some debate. So all these conspiracy theories going around. I know Oscar's a little bit more educated. He's a little more educated on this subject. So I'll let him take it. Oscar, go for it.
Nah, it's just.
I actually don't know them. Let me hear it.
Well, the main one that's going around is that this disease was man-made and it's being spread around because the Illuminati, which is the people, air quotes, that control the world, want to depopulate and control the population, and it ties into it attacks older people, which older people have they use Social Security, so they want to minimize the amount of money that's being pumped into the Social Security. That's the.
Well, I'll go for right number one. Not a man-made virus. This virus is old. We've seen SARS, MERS, like I've said before. They're all coronaviruses. Not a man-made virus. Number two, we're seeing it affect more younger people than we thought, especially here in the U.S. It's affecting older people, but more younger people are actually getting severe reactions here than we initially thought. So we see pandemics. This isn't going to be the last pandemic. This isn't the first pandemic. Little known fact people don't know, Spanish influenza, as kind of we do know, is killed a bunch of people in the world, right? Knocked out the first reported case was in the USA, although it's called Spanish influenza. So let's understand that, this is something that can pop up from anywhere. It happens because a lot of times, again, the virus finds its way into a certain animal or a certain, intermediate host, and then is able to transmit to humans. Right. So unfortunately, that's what happened now. Things need to change. It's not, we're going to have better ways to prevent this in the future. And, again, SARS, the way that they reduced it, again, was improve animal husbandry practices in China, improving washing hands, improving, like social isolation down there. So there needs to be things, done over there, over here as well. We should have been better prepared. Like this, no excuse. There should be no excuse for it, and nobody should be pointing fingers.
Now that you mentioned the Spanish flu, and also Pooja had earlier mentioned how pregnant women, I don't know what the effects they're having on them, but the Spanish flu, from my understanding, it was targeting young people and pregnant women specifically, right? So
well, and also it did affect older people, but it was young people and pregnant women. Now what early reports with pregnant women, and Pooja can interject when if she knows too, but from what I'm seeing is we're not 100% sure about passing to the fetus yet. We have not found any COVID in breast milk as of this point. And I'm not for sure certain about what sterilization techniques they're using, at least during giving birth. But if Pooja has a little more answers, I don't know.
Yeah, so women can still give birth vaginally the natural way. Here in the tri-state area, parents, either mom or dad, who is exhibiting symptoms and is ruled out COVID or is positive for COVID, the babies are being taken right away to either the NICU or the pediatric ICU just to be observed to make sure that they're okay. So far, thankfully, we've really only seen one infant death, and that was in Chicago this past week. So I think that, and they have not found any connection, and I'm not going to say for sure because it maybe not be like found a connection yet between passing it on to the fetus. But so far, thankfully, there has not really been a huge issue with pregnancy. Granted, there is a 30-something week pregnant woman in Jersey right now who is intubated on a ventilator. So we really don't have enough data at this time, but we do have these isolated cases of like one infant here and one pregnant woman here, and whatever else pops up on a day-to-day basis. So I don't think it's enough for us to really know safely yet, but thankfully we haven't seen much of a disaster in that population.
Right. And also Shivan was mentioning earlier about prevention and testing, right? So from my understanding, China, maybe they learned a little bit from the SARS outbreak, in which they began opening up clinics specifically for people who are showing fevers. So basically what they're doing, right, is they're checking everybody anywhere they go, buildings, restaurants, for a fever. And then if they do find something, they're sending them to these isolated places where everybody's protected. Why did we not do that?
Because we just didn't, there'll be delay in the federal government, delay in the state's government, delay in just businesses in general getting on board with this, and people, our population. Unfortunately, it didn't take it as seriously as it should have been.
Yeah, I think we all had the very American mindset, like, oh, we're above this, like we'll never get affected.
Yeah,
there's no way. Like China's China, and Italy just had a really old population. Like that's not us. But this thing has clearly shown, no matter where you come from, how old you are, how rich you are, how poor you are, like it has not differentiated anybody apart.
Yeah. Is it too late for something like that, or can we still convert maybe those emergency clinics or something? What's the process to converting them into something?
I mean,
like
that's
this?
kind of already happening. Like Central Park is opening up a bunch of tents that can be used as medical treatment areas. This giant ship that just came into New York the other day can hold up to 1,000 ICU beds. So I mean, it's not too late, but the issue is that it is too late. Because we already have such a massive effect. So
massive spread.
We're gonna have waves. And we could get better. We get at a point where we're getting better, but there could be a second wave if we don't adhere to social practices, essentially a social isolation. If we stop it early enough, guess what? Wave 2 is gonna come in, and more people will die.
Right.
They're predicting now it's gonna close to 250,000, which is crazy nowadays. People could say, oh, we've had this before, blah blah blah. We're in modern times now, and it should not be this. We're post penicillin and antibiotics. We have all these drugs, but unfortunately we're right now we lack the insight, I'd say, to prevent this from happening.
Right. I think one of the most frustrating things about this situation was people comparing this to the flu and saying this isn't as bad. The flu's worse. The numbers are worse.
So,
and I think this misconception is going a little bit away. But can you just maybe speak on that a little bit?
So yeah, what I will say, flu is bad.
Right.
Flu is bad. Again, like I said, 50,000 people die a year from the flu in the U.S. and way more in the world too. People didn't understand the virus early on. They didn't know how bad, how infected people could get, how rapidly it could spread. And like I said earlier, flu is, we know it's droplet. We know it's only through these droplets, but coronavirus, we're still understanding how it transmits. So that's the scary part. We don't know if it's airborne. We don't know if it's just droplet. It's hard to say. And so that's why we're taking every precaution we can at this point that we can do. And we, that's the biggest fear. It's flu is bad, but flu, we've had some treatments that we can use, oral pills that we use to treat the flu. We have better testing for flu that comes back really fast within a couple hours. In minutes, actually. We have a rapid test for that, and it's been validated. It's not the best, but it still works. And we understand the flu because we've kind of seen it, and we have a vaccine for the flu. Now, flu vaccine, people always say they get the vaccine and they get the flu still. That could be true. There are different strains of the flu. But what happens is you could have gotten a detrimental flu that you got intubated, but the vaccine actually gave you little immunity to help prevent it to get to that bad point. So a lot of people, we see more people who are not immunized get really bad infections with the flu, but the people who are immunized, they get the flu, they feel bad for a few days, but then they get better.
But it's not terrible.
But it's not terrible. It's not life-threatening. So
right. And I think, there's this whole anti-vaxxer movement going around, and I don't think they understand that it's kind of a selfless act in a way to get the flu vaccine, because not only are you doing it to prevent yourself from getting the flu, but you're making like a little barrier and giving your the flu a harder chance of spreading. And that's the issue with COVID, right? That nobody has immunity to it.
This is what it looks like if vaccines were not around. This is exactly what the world would be filled with: measles and flu and horrible polio and all these crazy things if we didn't have vaccines. Like this shows anti-vaxxers what the world is like
without
if we
vaccine.
didn't have any of this.
It goes back to that, to conspiracy theories and Illuminati and all of that.
Yes.
They want us to not to vaccine because it has a chip and like all this crap. But when we saw with the, like you mentioned it, the measles, like we had an outbreak of the measles. Like, well, why did that happen? Because they're not getting vaccinated. The kids are not getting vaccinated.
It's just crazy, man. All these things going on, but
Exactly.
I think,
more than that, also, like the big thing about flu is that it takes 2 weeks to even work. So you can absolutely get flu between getting the shot and getting
most vaccines are like that. It takes most vaccines are like that. It takes a couple of days or weeks to actually take effect. So.
Okay. So how far are we from actually getting a vaccine for this?
So the issue
supposedly
is,
one has already been found. I mean, several, but it takes like 18 months for the whole process to really go
testing.
through.
So this is the reason why vaccines they work, is because we actually do test them on people and we make sure they're working appropriately. There's no side effects, but people don't believe that, unfortunately, a lot of times, and but that's why it's taking 18 months usually, and there's warnings. People want it earlier, but there's warnings because, hey, if we do it earlier, we might be giving you a bad product or a product with adverse effects, and that could cause more harm. So that's why it takes 18 months. And that, unfortunately, the answer is not going to be the vaccine at this point, but it will be when we try to prevent this getting to a worse point or a season, like we said before.
That would be the scariest thing, for it to be a season.
Yeah. So if you all could give predictions as far as like maybe the next 6 months to a year, in your respective areas, where do you see this going?
I think it'll be done by July.
Okay.
So done. I don't think this will be done by July in the world. In the U.S., potentially we could see a severe decline. My concern is that we have a northern hemisphere and southern hemisphere, and they're opposite seasons. So my concern is in South America and in South Africa areas, this might persist because it'll get colder there, and unless they are doing better jobs of social isolating, which they're doing their most they can right now. But I'm going based again off of other virus data. It took them a year to get rid of pretty much most of the stuff. Schools reopening and things like that. A year from the beginning of it. So I think it could last until November, December almost, till we kind of see more at the end. The social restrictions may probably end up finishing early, maybe closer to July, I'd say, and stuff like that. And again, every area is going to be different. You'll see different social restrictions in Texas, New York, Jersey. All different areas will be different. So I can't say what's going to happen essentially with that. And again, this could also last more than 1 year. Spanish influenza was 3 years.
Okay. And I mean, here in El Paso, we're at 50 cases right now. So for you all who are, ahead and not seeing the future, but you know where this is going, what can you tell El Pasoans? Tell us what to do. Tell us how to not get to where
or how worse it's gonna get, and then how much better
it's gonna get bad. So no fiestas, no malam,
more siestas,
none of that. No, yeah, more siestas, less fiestas. I understand. So Hispanic families are just as big as Indian families. I get it, but you cannot have large family gatherings. No one can really gather for dinner. Protect your elderly. Stay away from
abuela and abuelito.
Exactly. If you're in a hospital setting, don't come home to people who have really bad asthma or have just really bad any underlying conditions. Isolate yourself, stay away. If you need to stay with a friend for a couple weeks away from your parents, if they're elderly or diseased, then you need to do that. And, even when you're in the same house as someone, try and sit apart, try and sit 6 feet apart. I wouldn't, if you guys have 2 different jobs, you're going to 2 different places, I would just really be safe about it. Stay clean, use your judgment. If you're coughing, sneezing, whatever, stay home. Don't be scared to call into work. I know it's hard, money's tough, but honestly, just do the best you can for the people around you. Everyone is going to take a hit financially everywhere in the nation, no matter what you do for a living. And so just know that everyone is in this together, but everyone should also be doing their part to protect the whole community.
Okay. Shivan, did you want to add anything to that?
Yeah, I mean, so basically all of what Pooja said is 100% correct. It's going to get worse before it gets better, especially in El Paso, I'd say. Right now, it's harder to test people, so that's why the cases are low. They're going to start testing more and more people once they have access to it, and you're going to see more cases pop up. That's what we've been seeing in waves. East Texas, so Houston, Dallas, you'll see a graph that'll show it like 1 or 2 cases, and then it just starts skyrocketing. And that's what's been happening everywhere in the country, because people initially don't have the test, so they don't want to test. And then they start testing and they see it skyrocket. And then unfortunately, we're seeing more and more people become sicker, and we don't know, or more sick, and we don't know why. Why some people are getting intubated and why some people aren't. It could be that they, diabetes and all that, but then we have young, healthy people too, unfortunately, they're doing. So it's going to get worse before it gets better. And it can get worse again if we don't adhere to these isolation techniques.
Okay.
And it sucks. I have family that is very, they get annoyed, the older parents and everyone gets annoyed that they can't see their grandchild or they can't see their, son or daughter. because their son or daughter either works in the healthcare field or they're exposed to people, so they're like, I have to isolate myself. But the parents just need to understand. I know it's hard to convince parents and grandparents of this stuff, but you gotta, as a youth, we have to do that essentially. We have to tell them like, hey, listen, this is for your safety. That's it.
Yep.
You know?
So do you all have any closing thoughts? Anything you think is important that should be mentioned that wasn't?
Just keep your head up. Honestly, for me, it's going to be keep your head up, maintain your social distance at this point. Try your best to make the most of it this time. You know, if you have kids, hang out with your kids, honestly, because you're not going to be able to probably do that once they're older. I guarantee you, they're going to be out of the house. So, if you know, right now it's time to spend time with family, but you know, be safe, use good judgment, be smart. This is a countrywide thing. This virus does not know race, gender. You know, it does not. It's literally attacking and killing people, and you know, it's a serious thing. I know we have a lot of memes and stuff going around. That, you know, we always laugh about it, but it is a serious thing, and we need to be great as an American people to try to prevent this from getting any worse.
And I just want to add to that, just be safe. For all the people who can stay home, like now is a great time to pick up your hobby or do that thing that you've always wanted to do. Spend time with your kids if you want, if you can. If you're all alone, just know that like your family's there for you, your friends are there for you. Use video chat, use Zoom, use FaceTime. Just utilize this time now for yourself. And then for all the people that are essential workers, just know that you're not alone, the only one going to work, and to hang in there. There's plenty of resources out there. There's plenty of free helplines for mental health people. If you're feeling overwhelmed or your anxiety is out of control, knowing that you have to go into work, knowing that you may come back and have been exposed. So just know that you're not alone, that there's plenty of resources. You just need to, all you need to do is reach out, ask for help. There's plenty of people. You see the goodness in everyone's hearts coming out during this time. So it's really important to just voice what you're thinking, and hang in there.
And people are going to get frustrated that there might not be treatments or vaccine, all that. Again, like I said, everyone has to be patient too. This is a changing virus. Everything's going to change every week from now on. And you need to make sure that we, you know, just be patient with your healthcare workers, your nurses, your respiratory therapists, doctors, everybody. Just, you got to be patient with them too. People get frustrated because they want to get tested, but that's, you know, you just gotta, you know, this is gonna take a little bit of time to get over. And unfortunately, as Americans, I know we suck at patience, but we gotta get there.
Yeah.
So.
Thank you so much, guys, for having us.
Thank you, Shivan.
No, thank you guys. Thank you very much
Appreciate
for
it.
being here.
Thank you, guys.
We'll hopefully we can speak again soon. I'll see you all
be
later.
safe.
Sounds good. Stay safe
Everyone be
out there,
safe.
guys.
Thank you.
Bye.
Bye.